Listen to Dr. Joe Hardy. Dr. Hardy is a board-certified family physician from Henderson, Nevada. He's Physician of the Year in 1999 and 2010. If that's not enough, he is also known as the Honorable Senator from Clark District number 12, who's serving his first term and is the minority whip in the Nevada House. He's also a father of 8, a grandfather to 16, and I don't know how he's qualified to talk on this subject after all of that. It's depression and PBC. Dr. Hardy, please. Joe, here's your...
Thank you, Buck. Appreciate it.
Okay, the podium is yours, sir.
If I had the right PowerPoint, there it is. Good job. Oh, I tell you, these IT people, they're good, aren't they? Give them a hand. I already had a disclaimer that if anything goes wrong with the audio-visual stuff, it's my fault. When I went up to the legislature, I had all sorts of problems with my computer, and I kept saying it's some problem I have, and they said, no, it's not your problem because they're paid to be nice to legislators. And so after a while they said, well, it is you. You have ULFs. And ULFs are not quite as bad as PBC, but nonetheless, ULFs are ultra low frequencies. So anything that's electronic that I touch or have anything to do with or know somebody who's using it, I have problems with it. So far, my hat's off to our IT people, and it's my fault. How many of you in the room don't have primary biliary cirrhosis? This is for you. So the rest of you who have primary biliary cirrhosis can pretend to listen. You can go to sleep because you probably have fatigue anyway, and I won't be offended. I did find an interesting thing with one of my props. I didn't know quite how to carry everything that I was carrying, so I used a crutch, and it's amazing how many people want to help you out. It's great. I found a new way to deal with things, and it's wonderful. At any rate, in as much as, can you hear me? Am I still, the audio still working? In as much as 25% of people with a chronic disease have depression, and I think some of you would agree with me that primary biliary cirrhosis is a chronic disease, then you are at risk for depression. Now, the good thing about depression is you live with somebody who you're making depressed. I know you don't believe it, but it's true. So there's a difference between I'm depressed because of and I'm depressed because I don't know why. And if we look at the just the demographics of depression, what sometimes we used to call primary affective disorder, how many of you know what the word primary means? Good. It means, from the we have 3 words that mean I don't know in medicine: primary, essential, and idiopathic. All 3 words, when the doctor uses one of those words, means he doesn't know why. But we can't admit that because we're doctors. So it's been interesting to watch the primary biliary cirrhosis research happen, because we now know that it's all genetics, and if it isn't genetics, it's infection. And if it isn't either one of those that we can really pinpoint, it's a combination of the 2. And if it is an infection, usually it's a virus. So if the doctor doesn't know what you have, it's obviously a virus. You guys have already learned that, right? I was thrilled to see this little pamphlet, Go Ahead, Ask Your Doctor. What usually happens as a physician. I'm a family doctor, so I don't actually know anything. I just pretend to know everything. And what happens with patients and doctors' relationships is you have a question, and you come into the doctor, and the doctor does what we call a history and a physical, and the doctor says, why are you here? And you tell him or her, and the reason you're here is because you stubbed your toe. And so the doctor takes the history, and it's not a long history, and does the exam, and it's not a long exam, and he said, you stubbed your toe. And you said, I know. And then when the doctor finally figures out that you know what he knows, and he says, take 2 leave twice a day for 2 weeks, and then you'll be fine, then he gets up to leave. All of this is, sitting down. And so he gets up to leave, and he goes to the door, and he turns the knob, and then he gets the real reason why you're here. Oh, by the way, did I tell you I have chest pain? Oh, new ball game. And the doctor comes back in, and he says, now, tell me about your chest pain. And, 30 some odd minutes later, we have a new thing going on. So what this is wonderful that they printed out for you, because this is what it's about. The relationship you have with your physician or your physicians is important, that you folks have a rapport and get out everything that needs to get out. I told somebody yesterday that they had cancer. And as soon as the doctor uses the word cancer or surgery, the person doesn't remember anything else of the conversation. If a person says you have primary biliary cirrhosis, the good news is you don't know what that is, so you remember some of the rest of the conversation. But once they explain what it is, then you don't remember anything of the rest of the conversation, because you're what we call normal. And so I told the person yesterday he had cancer, and he was going to call me the next day, and the next day, and the next day, and he was going to ask me the same questions, which was okay, because I was going to tell him the same answers, and he would process that. It's a process of processing. So what I encourage my patients to do is this kind of thing. You write down, what happened and what goes on. The step that isn't here, what usually happens is we have the doctor ask the questions, you give the answers, and the doctor writes it in the chart, and then you come back in 2 weeks or 3 months or whatever, and this process goes on. In the interim, you have questions or you have symptoms, and you write them down. And then what you do as the patient is you come in having your written list. And this is how you handle your written list. And then you tell the doctor one thing at a time. Then you tell him the next thing. He thinks you're done. You tell him the next thing. He thinks you're done again. You tell him the next thing. And I don't know if you're aware of it, but people, you're all people. And people are not a problem. You got that right? You are not PBC. You are a person who has primary biliary cirrhosis, and you happen to have other things going on. So the doctor thinks of you as a person and not a problem. And if you make a copy of your list, and when you go in and you give him, I know it's hard, you give him a copy, and you have a copy, and then he looks down, I use the word he because I'm a he looks down the list, and he puts you together as a person. So now he's not treating your most biggest, hugest, wondrous problem. He's treating you as a person who has all of these different things going on that will affect your hugest, most biggest problem. And little beknownst to you, perhaps in your lack of medical education, and I will parenthesize that, you know more than the doctor about PBC now than he does if you just go into your routine doctor. So be patient with the doctor. We're fragile. So he now has everything you have, and you now have a way to communicate and get all of it done, and that's really critical for any chronic disease. Okay, so depression. This is wonderful. Make a copy of it, give a copy to him, keep a copy for you, go down the list, make sure, and by the way, when you're done, you'll say, oh, he answered all my questions, put them all together, ordered the right lab tests because I go online and find out what he should do. And then he's done it, and you now have a relationship with a doctor who loves you, and you love him, and kumbaya, everything's going to work out fine. Okay? So this is wonderful. If a doctor is a primary care doctor, he sits down, there's a message there, take all the time you need, we got time. And usually, if you are depressed, usually your spouse, loved one, somebody is with you, and it makes it real easy for the doctor because the doctor is sitting down, you're up there in a position of power, and the spouse is over here, and the doctor's looking at you, and he senses that you don't feel well. And there's always a box of Kleenex in the room. So what I do as a family doctor, I give you 2 Kleenex. I know, I'm extravagant. So I give you 2 Kleenex. And the person who's not depressed looks at it and says, what's this for? And the person who's depressed says, why did you give me the Kleenex? It's called the Kleenex Test. Now, I'm not as good as Al Gore. I didn't invent Kleenex. But the Kleenex Test is a very simple way to feel how the person is feeling. So if you get the feeling that the person is feeling depressed, then you give them the Kleenex. And they say, why is this? And you say, it's a Kleenex test. And they cry. And there are a few places that are safe to cry. The doctor's office is one that it's safe to cry. Then we go further, because it's not necessarily diagnostic. Then we go further, after we've used the Kleenex, thank you. And we say, okay, if, this is a family doctor approach, by the way, okay? This isn't, all the highfalutin research people, but it works. And my mother told me, as a professor of child development, whatever works. She also told me that the middle child was the best adapted to things, and yes, I'm the middle child, thank you. So this is how you do this, and I may just bring this a little forward without falling off. Thanks for watching me. And so I say, I can't spell very well, all right? I admit it. I had to become a doctor, so they would think I spelled it right. So I say there are decreases and increases. Got the spelling? Okay, if, and we'll get to this, do you have, I say, and by this time I'm positioned myself so my patient is there and the spouse is there, and I've got the ability to look at the spouse without admitting I'm looking at the spouse. In these days, a spouse could be anyone. I use this term very generically. Thank you. So I say, do you have decreases in mood, motivation, fun, interest in things that normally interest you, hope, why try, nothing's going to work, self-worth, nobody loves me, everybody hates me, I'm going to go eat worms, decision making, what's for dinner, I don't know, why do you make me make these tough decisions, sex drive, I can't spell sex so I have to write libido, memory, that's the one I usually can't remember, and concentration. And I abbreviate the concentration with the C-O-N-C because I can't spell it. I already admitted that, but the good news is by the time I'm done they say, what was that? What does that tell you? They don't have memory, they can't concentrate, all right? So then I go over to the other side, and do you have increases in irritability? Little things upset you. Why did I get so upset about that? I'll never do that again in 5 minutes. Later. Feel guilty about things that aren't even your fault. I had a gal come in, and she had guilt for the fact that the troops were in the Gulf War. It was her fault. So I call it the guilt that you can't repent of. No matter what you do, you still feel guilty about something. So you have guilt, you have apathy, I don't care, just leave me alone. You have fatigue. You have escape thoughts. I want to run away, I want to get away, I want to go to Disneyland, I want to get married, I want to get divorced, I want to kill myself, I want to, and that's how I say it. So I put all of the escape thoughts that we normally have. Everybody feels better at Disneyland, right? Except if you're depressed. Because if you spend money, take vacation time, go to Disneyland, everybody is happy in the happiest place in the world, except you. And when you come back, you've wasted your vacation time, you've wasted your money, and you still feel just as bad as you do, except now you don't have vacation time and now you don't have any money. So there's a rationale for what we try to do to feel better. And what we do to feel better doesn't work if you're depressed. And then I say, and there's a change in sleep or appetite, maybe more, maybe less, but doesn't make any difference what you do, it doesn't seem to work. And then I say, if you had, I say, do you have any of these? And they say, well, yeah, I got all of them. And all this time I'm looking over at the person and the spouse, and the person is doing this and the spouse is doing this on each one of them. And then I say, if you had 5 to 7 of those for more than 2 weeks, you would qualify for diagnosis of depression, otherwise known as primary affective disorder. And what does primary mean? I don't know. And so I say, if you don't know why it is, who cares why it is, okay? I don't care, I'm a family doctor. So whatever it is that caused this to happen, and we don't know what it is, it's probably a virus or an infection or, who knows, or genetic, that's always good. Genetics always good. Are your parents alive, I ask? If they're alive, don't blame them. If they're passed on, it's mom's fault. Okay, we always blame our mother. That works. Okay, so it's, so we got this. We now have the diagnosis. And one of the reasons I do this is because of this little thing here. You know, you're taught in medical school to ask what we call open-ended questions. Well, you know, how do you feel today? Well, how does that make you feel? Well, what do you think about that? And how's that? And, you know, 20 minutes later, you're done with one of them. If a person has a depression, they usually don't make decisions very well. And it takes time to do it. So 45 minutes later, you're still trying to get from them what they feel like, and you've already got it in less than, you know, 30 seconds. So you now basically know what they've got, the spouse has agreed with you, and you're going to treat them. But first, before you treat them, you have to do something so they understand what it is. What is it that I've got? Can some of you actually see this? Okay, the ones in the front are saying yes, the ones in the back don't care. Okay, so if it's, you know, it's chemistry. We work by electricity. I got to use my prop because I brought them. How many of you have tasted electricity? The rest of you are lying. A class D volt battery, put it on your tongue, and you taste electricity. That's how we work. We work by electricity. You hit your funny bone, which is really your ulnar nerve. It goes like this, and you shake it. It's going to get better if you don't shake it, by the way. But it looks good when you do this. Pretty soon somebody's putting a tongue depressor down your throat and making sure you don't bite your tongue. I don't know. It's risky. So we work by electricity. We work by the chemistry of electricity. So you've got a neuron, and this is actually not the actual size. Okay? This is a nerve cell, and that's another nerve cell. And electricity comes down to the end of a nerve cell, and the neurotransmitters go across the synapse to the next neuron, and then the electricity goes on, and that's how we work. And what we do with depression is your neurotransmitters don't keep going the right direction. So what we do is we use a non-addicting, not habit-forming medicine that you can't get rich selling it on the street at the synapse level to prevent your neurotransmitter from going backwards. Even a family doctor can understand that. So, and then what we do is we put you on that medicine, and it usually takes about 3 weeks for you to notice that you're actually doing better. And the way you'll notice you're actually doing better is you'll say, I had a good day yesterday. It's not speed. And I warn the people that your spouse or somebody who knows you well out of the clear blue sky will tell you that, gee, you're doing good today. What do you mean I'm doing good? I've always done good. How can you dare accuse me of doing good? Because they see you improve before you do. And not all symptoms get better at the same time. And that's why there's this black box warning now on all of the medicines that we use for depression that will say if you take this medicine you're going to commit suicide. At least that's what it sounds like when you read it. So if your escape thoughts are not getting better by the time your motivation gets better, now you're motivated to kill yourself. Okay? So usually it doesn't cause you to have escape thoughts or suicidal thoughts, but it allows you to have those not go away at the same rate that something else will, for instance, and we don't know who that is and who that isn't. So if you have an escape thought, like I want to kill myself, so I say, have you had any thoughts of hurting yourself or killing yourself or anybody else now, because that's part of the problem now. And they say, well, yeah, I've thought about killing myself. And I say, how would you do it? And they say, well, I would shoot myself. And I say, do you have a gun? And they say, yes. And I say, I want the gun. So I've had guns in my attic. And by the way, all guns are loaded. This is a parenthetic statement. So when somebody brings their gun over to my house for me to keep it till they're better, and he goes to pull it out by the barrel out of the back seat, I say, stop. It's not loaded, he says. I said, stop. And I check it, because that's what I do with guns, and there's a bullet in the chamber. And all it has to do is catch the trigger, and now I feel really, really bad in front of my house, because it's all about me. No, my wife says it's not about me. I get those confused. So 3 weeks, they're going to feel something. If they don't feel something in 3 weeks, they may feel something better in another 3 weeks. If they don't feel anything in 6 weeks, you're probably looking at doing something else. Now, the rest of the story is, if they have a chemistry of depression, and they're not good at making decisions, this is another little caveat. If they're not good at making decisions, I get them to promise me get them to promise me two things. One is, you'll take your stupid medicine. Because that's what they think it is, right? I'm tough, I don't need anything, but they'll promise me they'll take their stupid medicine, and they won't make any major decisions. And do you know what a major decision is when you're depressed? So I say, when you go to IHOP and the waitress asks you, would you like blueberry or strawberry syrup? You say, I'm not allowed to make any major decisions. Right? Let somebody else make that decision. So, no major decisions, take your stupid medicine. At some point, knowing that there's a chemistry involved, you will say, do you have any other symptoms such as anxiety? And they'll say yes or no. You'll ask, do you have panic attacks? And the people who have never had a panic attack will say no. People who have had a panic attack will say yes. Because panic attacks are scary. I'm going to die, I hope my underwear's clean, and all that kind of stuff. And then, so you treat them, and you see them back in 3 weeks or 6 weeks if it didn't respond. But 3 weeks later, I see him, sooner if there's a problem. And so I see him, how are you doing? And because that decision thing is, I say, okay, on a scale of 1 to 10, 10 being zippity-doo-dah, zippity-a, my oh my, what a wonderful day, 1 being life isn't worth and I should kill myself, where are you at? And they say, I'm 6. I say, what were you 2 months ago? Because it took them a while to come in anyway. And they say, I was probably 2. And if they had suicidal thoughts, they were probably a 1. And if they didn't want to admit they had suicidal thoughts, when I saw them, but they now are admitting they did, they can say a 1 and, we can deal with that. So I say, so you feel improved? They say, yeah. And the husband's over there. Or the wife's over there. Yes. I shouldn't do this and dispel all your preconceived notions, but men are different than women. Some of you may be aware of that. So men don't come in all by themselves or without a note nailed to their chest about what's going on. So yes, there's somebody who's saying yes, they're improved. And what is very heartening is when the person comes in and they're not accompanied anymore, and you know that what that message is, they're better. And that's the message you get when they come in all by themselves. That means, the spouse thinks they're better. Okay, so if they had, do you count things? Do you do things over and over? Do you check things over and over? Do you have to think of things over and over? Do you have a hard time going to sleep because you can't stop thinking about things? Now we're into the obsessive compulsive disorder, and that usually takes a higher dose of the medicine. And I tell them that. But you start low and you work up and you treat them and they feel better. And obsessive compulsive disorder usually takes a higher dose longer to take effect, even though they're improved with their depression and maybe some improved with their anxiety. But if they don't count this wall, I know some of you have already counted the wall ceiling tiles in here. You already know that there's 36. I'm lying. And if you don't count it, you get anxious. And that's the obsessive compulsive disorder. In order to get into medical school, you have to be obsessive compulsive. How many of you have ever taken a class with a pre-med student, a serious pre-med student? They're jerks. I mean, my friends would say, I used to be a pre-med student. I admit it. It's kind of a 12-step program. My friends would say, why are you arguing about that? You got a 98. I said, but I was right. So if the obsessive compulsive gets in the way of your life, then you've got the disorder. And, there can be a fine line between that. But at any rate, if you don't do the thing that you are obsessed to do or compelled to do, then you get anxiety, and that anxiety is overwhelming kind of thing. So you treat them. And if they have a side effect of the medicine, then you change the medicine. Common side effect would be an inside jitteriness, I call it, or a tremor with the selective serotonin reuptake inhibitors, such as fluoxetine, otherwise known as Prozac. So there are side effects that you expect with some medicines, and you can warn them about them, or if you don't like them, you can just have them experience it. One of the classic side effects of some of the medicines is lack of orgasm. And some of you tell your neighbor what that is. But if... Is this mic on? If the woman doesn't have orgasm, it's different than if the man doesn't. The man will tell you about it. But you may have to ask specifically for the woman. Sometimes the problem is you feel so good on the medicine with everything else, you don't want to admit that there's a side effect that you don't feel comfortable about talking about anyway. But if you're a man and you don't have orgasm, they're not going to take that medicine. Okay, so we did 3, we did the follow-up. Okay, now if I were to pretend that I had a PowerPoint, so you didn't think I was totally unprepared, we'll see what's on the PowerPoint. So it does apply. People with primary biliary cirrhosis can get depressed, but the fatigue usually has nothing to do or may not have anything to do with depression. So the studies, did you talk about brand name Provigil yesterday or Okay, so there are things that can be done for the fatigue that may actually work. But there's a difference between the structure and the function. If I take a x-ray of my finger right now, it's normal. If I push on my finger, it hurts. I take an x-ray of it, the x-ray is still normal. So the doctor tells me your finger doesn't hurt. See, wait a minute, it hurts. Well, no, the x-ray is normal. So there are some things that just because you have a normal test doesn't mean it doesn't cause you a problem. So you do know the difference between hardware and software. You can throw software further. You know, the person, the problem, we dealt with that already. You know, you got a bad disease, but you're not dead. You know, it's kind of nice to know what you're going to die of, right? But the bad news is you can't die of a heart attack. I say that because, you know, the cholesterol goes way up, but your LDL goes way up, but your HDL is the one that really goes up, which is protective of you. So it's unusual for the PBCers to have heart attacks because of their good kind of cholesterol at any rate. Did we mention that yesterday or today? At any rate, if they didn't, I just did. So how a doctor thinks, we talked about that. You've got the good thing, the SOAP notes. We don't know why, and there's no blood test for depression. There's nothing you can do. Now, having said that, it's not uncommon at all for a autoimmune disease, a antibody against the mitochondrial in the each cell has a little mitochondrial, which is the energy producer in your cells. And you have antibodies with PBCers. 90-95% of the people with primary biliary cirrhosis have antibodies against the enzyme structure within the mitochondria. So you would anticipate you would be fatigued if you have a problem with antibodies against the thing that makes you have energy, right? But there's no blood test that actually shows depression. So the trap is when you're depressed, you know, this nobody loves me, everybody hates me, I'm going to go eat worms, this self-worth thing. I deserve to feel badly. That's more depression, and if I understand why, if I think I understand why I'm depressed, then what's the point of getting treated for depression? But if you're depressed and you happen to have PBC, you should probably be treated for depression. And how many people do we have here today? 120? I know some people knew that I was going to be speaking, so we don't have all the 120. So if we had 100, let's pretend there were 100, you know, 5 of you right now are depressed. You want a Kleenex? But we can treat it. So you treat depression. And so we went through, you know, so I did write these out. I think I spelled most of them right too. And the change in sleep is interesting, or appetite. May be more or may be less. When fluoxetine, otherwise known as Prozac, first came out, they said, oh my goodness, it's a diet pill. It makes you lose weight. And what happens with depression, if you're depressed, you're either going to eat more or eat less, depending on what enjoyment you get out or what you don't. So if the person was eating more when they were depressed and we treated the depression, they'd eat less, they'd lose weight. If they ate more, if they ate less and we treated them, they would gain weight. I mean, that's the chemistry involved. So it's a change in sleep or appetite. We talked about the Kleenex test. Depression is a diagnosis of exclusion. It overlaps with all sorts of things, and it has to last at least 2 weeks before you can make the diagnosis. We talked about the other diseases. that you can have, and so you can have a secondary affective disorder, which is a fancy way of saying you have something else and you have depression. Obviously, when you tell somebody you're going to use a medicine, they say, it's just a crutch. And I say, if you sprained your ankle, what would you use? Well, I would use a crutch. Well, I found if you use a crutch coming into the, I had somebody volunteer to carry me up the escalator that wasn't working. It's great. So there are advantages to crutches too. So we talked about the synaptic bridge. Oh, cognitive therapy deals with the counseling involved, and I'm a doctor, so I'm a hammer. So if you come to the physician, the MD type or the DO type, if you come to the physician, they've been trained to use hammers. So that would make you a nail. Okay? So in as much as you're nailed, they're going to pound on you. They're going to give you medicine. If you go to a psychologist, they're going to talk about it. And if you do both of them, you may get a benefit of both ways. That's my little tribute to psychologists. And we went through that, and the selective serotonin reuptake inhibitors, the tricyclics, the heterocyclics, and others, we have all sorts of them. And when you're depressed, you don't know what to do. And in as much as you don't know what tools there are at the hardware store, if you're like me, you have a problem, you go to the hardware store to get a part, and you go back home and you realize you can't take apart the plumbing, so you have to go back to the hardware store to get the tool. You get the tool, you go back home, you take it apart further, and you find out there's another part you need. And then you go back to the hardware store, and then you go back home and fix the thing. So when I retire, I'm going to be a hardware salesman because I get to see the same person 3 times in a day, as opposed to what I do. To illustrate, what is this? Specifically. Now, if any of you know this, I'm impressed. This is what we call a faucet washer seat wrench. This is the second time to the hardware store trip. And then I had to get the part, once I got it apart, to fix the part that was leaking. So everybody should have one of these. Faucet washer seat wrench. Now, because you don't know it exists, you don't know that there's help. And one of the things that you can do, am I doing okay? One of the things that you can do, I don't care if I am or not, is you can tell your friends, you know, that there are things that you can do that will help you, because once you've been depressed, know you can get better, you're going to have somebody else that's in your sphere of influence, and you're literally going to save their life. You're going to feel impressed to go see him, you're going to go see him, and you're going to have somebody say to you later, you know, the day you came over, I was going to kill myself, and I didn't because you came over and I had something else to do. You're literally going to save somebody's life because you've had this lecture. You're not going to be afraid to tell somebody that they're depressed and give them a Kleenex. Okay? Take your medicine. We went through that. I think this is where I have to stop, because didn't it say, oh no, it said don't stop it. So you can help others, refer, wear a wig. Right? So my mom, when she had cancer and had chemo, and, you know, she bought a wig. I mean, it's hard not to be happy around people who have, you know, 3 colored wigs. You know, one of the things when you're depressed, you can't make decisions, okay? So, Mom, what do you want for your birthday? Ugh, I don't know. Ask for frogs. It was fascinating. My mom said, I want frogs. So we would buy frogs. You know, it's amazing how many frog kinds of things there are. And it required a hunt. And so we would buy her frogs. And we got a frog for her funeral with flowers. So it turns out, the irony of it all, she didn't even like frogs. But it gave us something to do, and then when she died and we were divvying up all the good things, the most prized possessions were the frogs that we gave her. And so every grandkid got to take back their frogs and remember Grandma. It was wonderful. Wonderful thing to do. I don't care what it is. I was going to bring my elephant. I'm a Republican, I admit it. And I have a plastic elephant about this big, and I thought, oh man, I don't want to call that, you know, the crutch and an elephant. That would be overplay. The other thing I do is blue pen. I'm going to draw the lake of life. Now this is impressive. Are you ready? Okay. The lake of life. Yeah. We should have this in the live auction. Yeah. Okay. So this is you, because we're all interested in green things now. This is you in the lake of life. Can you breathe?
Yes.
Can you breathe?
Yes.
Can you breathe?
Yes.
Can you breathe?
Yes.
Can you breathe?
No.
Can you breathe?
No.
Can you breathe here or here better? You can't, can you? Okay. This is so good. I got options now. This is artistic, I admit it. Okay, so in the lake of life, a little rain must fall. Right? The rains come down. You all went to Sunday school, right? Rains come down. The floods come up. Right? Rains come down, floods come up. Can you breathe?
No.
Can't breathe. So if you are well anchored, because that's what you're supposed to be, right? If you're well anchored and the floods come up and you're held down, you're in trouble. So you literally have to cut yourself some slack to get above the water level that you can't breathe in. And when you get up here, you can breathe again, and that's all the medicine does. It just allows you to get above the level of the chemistry that you need in order to cope with all of the things that are happening. I probably ought to shut up now. I think I've worn out my welcome. Thank you. And I think this has a pointer. See that little cloud right there? It's a rain cloud. Okay. When looking for a psychiatrist, not a psychologist, how do you find one knowledgeable in PBC or autoimmune disease? You can't. That was easy. Psychiatrists, I don't know, if you ever go to a psychiatrist, you're going to find that they don't talk. In fact, they don't do anything. Quote, unquote, from my patients. They go to the psychiatrist, he didn't do anything. I said, well, did he write some medicine? Well, yeah, he did that. And I say, that's all psychiatrists do. They don't do anything else. They don't talk about your mother. They don't lie on the couch. They don't talk about your lost dog. They don't do anything. They just listen to you. They write medicines, and that's all they do. If they think you need some cognitive behavioral therapy, they get you to somebody who knows what they're doing. So the universal feeling with the psychiatrist is they don't do anything, but actually I use the psychiatrist as a family doctor to refer to when I am trying to deal with something that isn't responding to the medicines I've tried, because they're the expert on medicines. That's what they do. They are the ultimate hammer, and you are the ultimate nail when you go to the psychiatrist. So start with your family doctor, ask your family doctor, your internist, who you should see and what you should do. And yes, Valium works for anxiety, and yes, it's habit forming. And the question would be, how long should patients be on medicine for life? If you've had a depression for more than 2 to 3 years, you're probably going to be on it for the rest of your long and healthy life. And if you go off of it because you think you're smarter than the doctor, it'll probably be about a month and you'll wish you hadn't gone off of it, but then you'll wait another 2 months because you don't want to admit to the doctor that you went off of it and how mad he's going to be at you. But he's done this before and he won't say mean things about you. He'll say, you went off of it, didn't you? Yeah. Okay. Sleeping pills such as Ambien. Ambien's probably one of the better sleeping pills, and yes, you can take it, but bottom line is anything that you are trying to do sleep with that's a temporary sleep aid may not work as juggling the medicines that aren't habit forming, and the real problem is the chemistry, and Ambien doesn't treat the chemistry as much as it does the symptom. And yes, if you take too much medicine, you can kill yourself, whether that's Tylenol or anything else. And so we ask the question, have you had any thoughts of hurting yourself or anybody else? What is the difference in depression and bipolar? Bipolar is the same thing as depression, except you get manic. And you buy things, or you sexually do things, or you gamble, or you stay up all night and accomplish more than anybody else in the real world can accomplish. And it's very hard to treat manic people because they like to feel like they can do everything in the world and have a cape on their back and lift up tall buildings and stop rushing locomotives. What does our medical history sheet have depression written first on the list? Is it a law? Every dermatologist and gynecologist, etc., asks about depression. The good thing about depression is it's so common and it's so treatable that if anybody finds out you're depressed, they can get you to somebody and you can get help. And did I use the word irritability? And so it's very easy to get irritated with people who are trying to help you. I tried several SSRIs, including Wellbutrin, which, by the way, isn't an SSRI, but they gave me insomnia. Any solution? Yes. Remeron is a good medicine to make you sleepy. So its side effects, sometimes we choose the antidepressant for its side effect. And Remeron is a great one to make you sleepy. Trazodone, similarly, is one that's associated with, and the tricyclics, the Elavils, the tofranils, those tend to make your dry mouth. So if you spit a lot, that would work. Nobody does that, by the way. So many prescriptions have liver side effects. How we determine how long to take something. You know, all of the medicines that we use for the antidepressants, almost all of them are metabolized by the liver, so you just have to use a lesser dose if your liver is affected, or use something else that's not. And Tylenol, they talk about Tylenol in some of the literature, which is metabolized by the liver. And unless you're end stage, you can probably get away with 2 grams of Tylenol a day. But you're going to talk to your individual doctor about that. There is a river in Egypt called denial. And how can you begin to involve a spouse who lives in denial with your disease? That's normal. It's a defense mechanism. It's real. And bless your heart. If I was diagnosed with depression and prescribed Wellbutrin, how long should I stay on Wellbutrin? It depends on how long you had it before. So it depends on how long. And if you're a smoker, Wellbutrin works for that too, but that's another issue. And smoking's bad for you too. Did I say that yet? Smoking's bad for you. Man, you guys were busy. What essential blood test should be done for monitoring the PBC and how often? And that was the other lecture. You should have come. I got away with that one, didn't I? Your doctor's going to figure that out. Oh, did I say I was a politician? I got to do this. So now the good news is you can travel across state lines, you can keep your insurance, you can, there's no pre-existing clause, you're guaranteed that you're going to be able to whatever. The only bad news is you can't get a doctor because we don't have enough of them. And then we talked about the Provigil or the Monofindil for the fatigue. My itching is irregular, and doxepin sometimes works, and some people use cholestyramine, but there are lots of things. Anytime there are lots of things that doctors try, that means none of the things actually work very well. That's another caveat. Why would one have albumin in your urine? Usually that's a kidney problem, and this isn't about kidneys, so I'm not going to answer that. The genetic basis of PBC is real. Usually there has to be some trigger, so it's a multifaceted kind of thing. So yes, you can inherit PBC, but you don't catch it. So you don't catch PBC from somebody, but you can inherit the tendency to get it. Most people, there is a certain level, I think it's with the antimicrobial antibody test, there's a certain level that are positive anyway in the population, so it is not diagnostic, but of the PBCers, 95% of them are going to have positive with even a positive ANA. And by the way, depression, I didn't say anything about hypothyroidism is associated with it. So yes, you want to check your thyroid because you can treat that with thyroid medicine. Thank you very much.
That was terrific, Joe.
You were very good. You laughed at the right places.
And I got a little more hardware for you to take with your stuff, Joe. Thank you so much. Entertaining as well as informative. Appreciate it. Let me take that. Hope you'll come back and see us again.